some very basic ideas that one might consider and apply toward both the idea of prevention and the active things one could do as an individual in the management of cancer. Assuming I can make this. So in the conventional medical model, the focus is on early diagnosis for the presence of the cancer and determination of the characteristics of the tumor and cancer cells. Now, that alone has been evolving because it used to be the characteristic was it coming from the colon and did it spread, or is it coming from the ovary and did it spread, and now, of course, the next evolution is to really understand the unique biology of a tumor cell, its unique susceptibility, as Dr. Celeru was referring to, and that's creating an exciting change in the field so that therapies will be targeted appropriately with hopefully higher rates of benefit to people. And in the conventional medical model, eradication of the tumor is the therapy, is surgery, radiation therapy, various medical therapies that include chemotherapy, hormonal therapy, and the use of biologic agents. In the complementary medical model, the idea was to understand the person who has the disease, and that's always been the case, the terrain in which the problem arises, and we spoke about how obesity changes the biology of one's cells, the nature or energetics of the person, and the environment the person operates in, the biology of the individual. Some of this is linear and kind of lends itself to rational exploration, and others of it is more nonlinear. That is, when you think of the energetics of a person, are they people who are hot and they react dramatically to things, or are they sanguine or cool? All of that plays a role in sort of trying to address therapies that might optimize people's background health so they could respond best to the therapies that are chosen, that they choose and are chosen or recommended to them. And the therapeutic goals are to optimize nutrition, assimilation, and elimination, support detoxification processes, and boost innate host resistance. What you're trying to do is modulate the terrain, the environment in which the cancer might arise and grow and spread, to remove metabolic factors that favor tumor proliferation, progression, angiogenesis, and metastases. Angiogenesis is the growth of new vessels, which is very important for tumors to get beyond being a small localized problem into a bigger problem. The hallmarks are self-sufficiency and growth signals, which Dr. Celeru spoke of already, and disregard of anti-growth signals. Limitless replication. One of the things that the sirtuin gene does is that it increases telomerase, which is a sort of a string, if you would, upon which genes replicate. And as you get older, the string shortens and shortens and shortens, and that's it. The SIRT gene, if you can make it work longer or be more effective, allows for lengthening of telomerase. So maybe there's good things about that, but in the wrong environment, it's not good. You want to, cancer cells try to evade apoptosis, which is programmed cell death, and they avoid differentiation. And the more undifferentiated those cells, the more aggressive they are, the more dangerous the disease is. And they have sustained angiogenesis, tissue invasion, and metastases. And there are a variety of factors that are permissive to cancer growth. We spoke of obesity as a sort of manifestation of, let's say, even what we call BMI, body mass index. But there are thin, fat people, people who are thin or light, but they have a high level of fat as a percentage of their total body fat because they're not active. At any rate, metabolic syndrome is manifested by increased blood sugars insulin insensitivity, and increase of blood fats, along with a heightened abdominal girth, etc. Yes?
What role would stress play in that?
I think the stress is very significant, and in the end, it's one of the sort of, let's say, environmental factors that has, you know, an adverse effect on immune function, etc. And, you know, it's been hard to really garner, if you would, hard evidence about the effects of stress and the reactions to environmental factors on illness outcome. But you sort of sense it for a while, and it still exists. People were doing a lot of work with sort of mind, body, kind of orientations to the cancer phenomena, and it got out of hand when there was almost a little bit of a blaming, like, this is my cancer, it's my fault, I screwed up, and I have to take responsibility. And it's not that easy. It's very, anything you think is going on around stress is exactly what isn't. And it works because you don't recognize it, you know. Cancer permissive factors include systemic inflammation. So often when the C-reactive protein is elevated, or the cyclooxygenase enzyme activity is increased, etc., that is an environment permissive to cancer growth. And initiation, progression, and different, initiation, different. In other words, the whole process is encouraged by that state. Sticky blood or a hypercoagulable state is permissive to the progression and spread of cancer. And all of these factors, increases in fibrinogen, which we can measure simply, increase in D-dimer, which we can measure simply, and then things that cause an increase in new blood vessel growth. It has to do with growth factors that increase, copper levels that increase, and etc. And then hormonal imbalances that can have an adverse effect, particularly for the hormone-sensitive cancers, include increase in an enzyme that makes more estrogen, a reduction in a binding protein that allows for more free bioactive estrogen, and an increase in total estrogen. And then low vitamin D levels seem to have a relationship to cancer, along with other fat-soluble vitamins that include vitamin K and E. CoQ10 is not a vitamin, but a product, an antioxidant type product we make in our own body. And then an abnormal oxidation reduction process. We're all doing this very basic chemical activity of oxidation and reduction. And when it's not well balanced, we make more reactive oxygen species, which promotes inflammation and promotes an environment permissive to cancer. There may be decreased antioxidant intake and gene instability as a result of that. And then immune incompetence. So there are many factors, whether it's, the people who are on these newer immune suppressive drugs for organ transplant, which we're so good at now, but they become more vulnerable then to cancer, or the chronic use of steroids, etc., or environmental factors that have an adverse effect on immune function. So in the metabolic syndrome, you can look at waist-hip ratio, and the waist is up here and the hips are down here, or the BMI, which we spoke of, the circumference, which in men is greater than 40 inches and in women greater than 35 inches of the waist, fasting blood sugars. You don't have to have a very high fasting blood sugar to, again, create that environment that's somewhat permissive to cancer growth. A glycated hemoglobin, and this number is very low, and I'm not sure it's right. The one I've read more often is less than 5.5%. So if you were really efficient at managing blood sugar, then again, the environment is less permissive to grow cancer. But all of these are factors that play into this metabolic syndrome.